So, hi everybody. Thank you for being with us here today. My name is Shubhangni. I and Paras are coordinators of the Stanford South Asia Working Group, and we welcome you for our first event of the winter quarter and also of 2023. We have with us our speaker today, Muhammad Abdullah All Shakil from the University of Connecticut, who will be presenting his work, which is in the early stages of his doctoral research. Paris will be introducing him, and I will just maybe give you a small overview of what the South Asia Working Group at Stanford is about, what are the kind of things we do, just in case it interests you, and you can follow our events further. So the Stanford South Asia Working Group is a platform for students, for postdocs and early career scholars as a pedagogical and interactive space where they can engage academically in different kinds of activities. We've been working since early 2021, and we've had different kinds of events like paper presentations, group discussions, movie discussions, as well as panels and skill building workshops. What we aim to do and why we have this group is basically to have a safe space to be able to build a community of South Asianness around the world, which includes connecting all kinds of South Asianness within the United States as well as in South Asia, in Europe. And we're happy to report that through different events, not only are we able to cater to a variety of topics, but also different kinds of participants who engage both as audiences as well as participants and speakers and presenters in our group. So we have a mailing list, we have a website, a web page, which I will share with you and put in the chat, through which you can stay updated on our events. So with that, I will pass on the mic to Paras, who can introduce our lovely speaker for today and get the ball rolling. Thank you.
Great. Thank you so much, Shubhangini, and thank you everybody for joining us today. We are expecting more people to join us eventually, but thank you for being on time. Friday mornings are a little awkward for everyone, even though we're all joining from different time zones. But let me just introduce Shakil really quickly, and then we can move on to the talk itself. So Shakil is a medical anthropologist from Bangladesh with almost 10 years of experience in environmental activism, public health research, and international development. Currently, he's a PhD student at the University of Connecticut. He was a Hans Wilsdorf Scholar during his MA at the Graduate Institute of International and Development Studies in Geneva, Switzerland. And that is a very difficult scholarship to get. His research intersects with activism and academia, and he's curious to explore the intersectionality between the systemic exploitation of people and nature, and the burden of chronic health conditions. Shakil is a father and an avid cook. He enjoys his time in nature and listening to music. And we are so very excited to have him inaugurate our winter quarter series here at the South Asia Working Group. Just a quick note about how we're going to run the event for today. Shakil is going to be presenting a kind of preliminary observation of what his research is going to be about, his doctoral research, that is, for the next 30 to 35 minutes. And then we'll have 15 minutes of Q&A. While Shakil is presenting, I would encourage everybody to keep putting questions in the chat box. And then you can actually have the opportunity to ask it once he's done speaking. And yeah, we look forward to the session. Shakil, over to you.
Thank you so much, Paras and Shubhangini and the South Asian Working Group at Stanford for inviting me today. So I will share the screen. Is it visible?
Yes.
Okay, perfect. Thank you so much. Again, thank you everyone for joining. I know many of you are joining from different parts of the world, especially from the South Asia. Those who are joining, it's midnight. Thanks a lot for joining at these hours. So as mentioned, I'm Shakil. I was born and brought up in Bangladesh. Currently, I'm a first-year PhD student at the University of Connecticut, focusing on medical anthropology. Here at UConn, I'm working with Professor Cesar Abadia-Barrero on the burden of chronic conditions for women. Today, I'm taking the opportunity to share my journey into environmental activism and the anthropological research in Bangladesh. As mentioned, I'm at the very early stage of my PhD as well as developing my research. I'm looking forward to your questions, suggestions, comments to develop my research further. In this presentation, I will share 3 stories. These stories are of people, their life, and their suffering within and along with nature. These stories encompasses the social, political, economic, and policy structures of Bangladesh that have been created a series of vulnerabilities. These vulnerabilities are interconnected and often co-conspired in exacerbating suffering for people and women in particular. Also, I consider these stories as a building block for my research and the pathways of life I have chosen. My engagement in environmental activism was separated from anthropological research. It was sort of a choice that I was doing it. I was doing both simultaneously, but on a different route. My engagement in environmental activism, as I mentioned, was separated for a long time. Eventually, these 2 worlds are coming together with my PhD project. Thus, today's presentation can be considered as an autoethnography co-authored with people and nature. I am moving to my first story, Scorpion Bite in the Ruins of Nature. And this story is where my commitment to environmental activism is cemented. July 2013, I'm in the 3rd year of my undergraduate study. It has been 2 years since I have been working with Bangladesh Youth Environmental Initiative, a youth organization trying to promote environmental education in the country. While discussing the impact of climate change on multiple occasions, I came across the name of a place, Gabura. Gabura is located in the southern coast of Bangladesh under Satkhira district. I often heard people saying Gabura is a barren land. No trees, no infrastructure, nothing except shrimp ponds. I also learned Bangladesh government and international development agencies extensively promoted shrimp farming as a climate change adaptation mechanism in the first decade of the 21st century. However, critics consider commercial shrimp farming as a systemic process of environmental degradation that has happened in the southern coast of Bangladesh. This critique of development interventions and the impact of salinity on people's life made me curious. I used a small amount of money saved from the last research assistantship to organize a trip to Satkhira and Gabura. One of my junior friends at the university was from that same region. He invited me to stay at his parents' house at night and accompany me in the morning. We made the 20 kilometers ride on a motorcycle of his friend, who is a sales representative, and had a scheduled visit in that area. In this part of the country, agricultural lands have already been converted into commercial shrimp farms. I barely saw any trees on our way. It felt like a desert where there is water everywhere, but no trees. While we were getting closer to Gabura, the landscape started to change. We were crossing multiple canals and houses appeared to be more fragile. The sign of poverty was vivid. The motorcycle dropped us in a small river port. I guess port would be an exaggeration for that space. Gabura was on the other side of the river. We got on a boat. There were goats, chicken, grocery supplies, motorbikes, almost everything. I realized locals take this boat to commute to Gabura, and this is the only way to reach there. I got off the boat and there was a sharp pain on my left leg. It felt like something had sliced my legs into pieces. Completely clueless. Suddenly, my friend saw a small scorpion coming out of my pants. I got a scorpion bite. I couldn't even enjoy the glory of getting a scorpion bite. I mean, it is shown in the Hollywood movies how it is. My friend was restless, wanted to do something, but there was no hospital or doctor in the 20 kilometers radius. Luckily, in 30 minutes, the pain was in a manageable stage. While I was resting, a local rickshaw puller, rickshaw is a three-wheeler pulled by humans, was also waiting for passengers. He was in his 50s. He asked me, what happened? I replied, I got a scorpion bite. He giggled and said, that must have come from the other side of the river. I was puzzled and a bit furious. Is he making fun of me? A scorpion migrated to bite me? He continued, you know, Cyclone Cedar, which happened in 2007, was in 7, Tabura was submerged underwater. Since then, the soil is just bitter. It cannot yield anything. NGOs drilled a 1,000 feet well. The water was still bitter. He further said, walk around. You will not find any tree, not even an insect. I walked a few kilometers and there were no trees. The first trip made me curious to ask whether this ruination of nature, or in the other words, the suffering of the nature, is due to climate change, or there are other factors associated. Over the years, I traveled to Satkhira and the southern coastal region of Bangladesh many times. Through my environmental activism, I had the opportunity to talk to people who are at the age of extreme suffering and activities. And I also talked to activists, those who are trying for a systemic change. It is clear that the ruination of nature in the southern coast of Bangladesh is not only the result of extreme climatic events. The ruination of nature in the region is embedded in the neoliberal development narrative that the state of Bangladesh has adopted. It first started with replacing the subsistence economy with commercial shrimp farming. In the 90s, international organizations like the World Bank and IMF were promoting structural adjustment policies. In part of that, there was an emphasis on cash crops. Initially, shrimp farming was lucrative over rice farming. Once farmers replaced their farms with shrimp ponds, they faced an existential crisis. Eventually, smallholding farmers were victims of predatory land grabbing. Local politicians and powerful elites were grabbing more lands to create larger farms. Government lands were also allocated to those powerful elites. Eventually, this whole area turned into an export-oriented shrimp cultivation zone. As a result, international NGOs and aid agencies such as USAID and World Fish were present in promoting shrimp cultivation. Through commercial shrimp farming, a larger group of people lost their livelihoods, and eventually they have all become dependent on Sundarbans, the largest mangrove in the world. Also, the crisis of clean drinking water escalated over the time as shrimp farm owners were intruding saline water from the river in the land, which contaminated soil and groundwater. This lack of access to clean water has horrendous health impacts, which I will discuss in the third story. But there is an important issue of systemic ruination, and which is, I thought, over the years is very important to think about. Often climate change narratives and the systemic environmental degradation doesn't come along together. Since my first visit to the region in 2013, there were at least 10 notable cyclones. So the frequency of natural disaster has increased. But the gap I see both in academic research and development narrative is there is a far more emphasis on climate change than institutional ruination of nature. Definitely, focus on climate change brings more money. I also face the dilemma and the struggle to keep both in parallel. So my question to the audience is, do you see the narrative of environmental degradation and climate change are connected or separated? I'll move on to my Next story. This particular story is a very personal one, and this is where I am landing into my current research project. February 24, 2020. It was supposed to be an ordinary day for me in Geneva, Switzerland. Going to work, coming back, doing household chores, and cooking. I woke up for work, and I connected my phone to the internet. The course of my life took a radical turn. Within a blink of a second, I was an orphan. I had lost my mother. For the last 20 years, she has been suffering from chronic muscle pain, and the reason of her suffering remained undiagnosed. The family had spent all of their savings and some of the assets to fuel her treatment. Any sort of new treatment mattered for my mother. It was a quest to find meaning behind her pain. In contrast, for the family, it was an additional cost for the month. The so-called middle-class family values and sentiment could neither give up the quest for diagnosis nor could continue bearing the price. When Ma finally moved on from this pain of the quest and the burden, it was not an emancipating event for the family. Instead, the question was repeatedly asked, what are the costs for if it cannot retain a life? Why do we pay? Eventually, once I managed to accept the grief and loss, I started to think, why only individuals and family carry the burden of chronic health conditions? Why state remains silent for its shared responsibilities? These questions eventually led me to design my initial PhD proposal on the burden of chronic health conditions for women. According to the World Bank, Bangladesh has one of the highest out-of-pocket health expenditures, 73.87%, which suggests only 23.13% of the health-related costs for an individual are paid by the state. In the recently approved financial year budget, the expenditure for healthcare was only 5.1%, which is 0.9% of the gross domestic production of Bangladesh. Despite the low budget allocation, and the biggest challenge lies in governance, execution, and regulation. Fundamentally, Bangladesh has a pluralistic healthcare system, both in terms of service availability and health-seeking behavior. Continuing the colonial legacy, the public healthcare system in Bangladesh is distributed through a 4-layer pyramid model: primary care services, sub-district level hospitals, district level hospitals, and medical colleges. Except medical colleges, all the other healthcare services are considered either primary or secondary, and medical college hospitals are considered as tertiary healthcare systems. Lack of adequate resources and corruption have dormanted service quality in the public healthcare system. In response to the gap, private not-for-profit and for-profit health services flourished in every layer of these healthcare pyramids. I mean the public healthcare pyramids that I just mentioned. Beyond the formal hospitals or clinics, there are pharmacies, medical representatives, private diagnostic centers, unregistered doctors, and traditional healers. All of these diverse health services counts for out-of-pocket expenditures. Similar to agricultural policy reforms that I just discussed in the last story, privatization of healthcare in Bangladesh started to happen in the 90s. Again, in consultation with World Bank and IMF, in all the 5-year economic plans for the government between 1995 and 2020, encouraged the growth of private healthcare system. Subsidies were distributed and emphasis was given on public-private partnership. In my master thesis on infertility treatment in Bangladesh, I observed a similar situation where people, those who have the money and the ability to buy, could have access higher level of treatment. In my research, women who had financial resources could access sophisticated biomedical treatments such as in vitro fertilization, popularly known as test tube babies. Some of them later got pregnant, but those who couldn't afford this treatment has little hope left. From these two cases, it is clear that the Bangladesh state has taken a market-oriented approach to health. There's a less visible effort in improving public healthcare supports. Now, the question that bothers me is that privatization of healthcare is not a problem for Bangladesh only. Instead, it is a global problem. Here in the US, during the pandemic, the prescription filling was a difficult situation. Recently, I had a conversation with one of my fellow classmates. She suggested she was also struggling in getting her essential medicine, similar to many others. So the question is, if privatization of healthcare is not just an issue for Bangladesh, and it's a global issue, how should look at pain and suffering in private spaces? Or how should look at the suffering of women in these private spaces? Now, I'll move on to the third story and request the audience to just keep this idea of privatization and private healthcare in the mind for some time. And eventually, I will try to connect these three different stories into one thread. This third story is about the prevalence of hysterectomies or uterine removal surgeries in Shamnagar, Satkhira, the place where I was my first story was located. March 2020. By then, my PhD proposal was already ready on chronicity and the burden of women in Bangladesh. But there was the specific case that I was focusing on. I was working as a research and insight lead at the BRAC Social Innovation Lab. I had a small pot of money which I could use to take the team in a place to look into an existing problem and then creating a new solution to those problems. I decided to take the whole team to Satkhira, the place I know really well, and the place where I have seen people suffering. So the team was looking into the livelihood issues that climate change has posed, how people were suffering or facing the challenge of livelihoods due to climate change and different environmental natural calamities. I divided the team into groups, and they were assigned to talk to different sort of livelihood options. While doing the fieldwork, my boss encountered a woman who was suffering from an uteral condition. She couldn't tell me in detail what was the condition. She told me the woman is in a very vulnerable situation, and I think we should help her. As I was in between organizing the logistics for the team and everything, I didn't ask many questions. Also, she didn't know much. The story just ended there. A few months later, I came across an online report by BBC Bangla, British Broadcasting Corporation, titled, "Why Are Women in the Coastal Belt of Bangladesh Unusually Losing Their Uterus at an Alarming Rate?" Looking at the title, I suddenly got remembered, okay, I was there, and probably this is the case. The report focused on the unusual prevalence of hysterectomies in Shamnagar Upazila. The reporter primarily blamed climate change as the main culprit behind the so-called uterine infection epidemic in the coastal belt of Bangladesh. The report also accused a network of community brokers, those who were referring women to the clinics. And the report also suggested these brokers, private clinic owners, and doctors were all part of this. These brokers were convincing women to go for hysterectomies because the treatment for uterine infection would be lengthy and would be costly. Instead, if they go for a surgery, it will be a remedy because once they get rid of their organ, there will be no pain and there will be no suffering. So women went for these surgeries and they roughly spend between 130 to 150 USDs. For many women, this was a big sum of money. So they borrowed from NGOs like BRAC, where I used to work. And the question remained, why these women are having uterine infections and why the uterine infection is so prevalent in the region. As there is no study or specific research on this topic, there are hypotheses that are circulating in popular media. Historically, in recent studies, it has been shown that menstruation and menstrual hygiene is poor in Bangladesh. The National Healthcare Hygiene and Hygiene Survey suggests that 10% girls use during their menstruation, they use sanitary pads. And the rest uses cottons or rugs. The most important aspect to these statistics is that girls often dry these clothes or rugs in hidden places because due to cultural stigma, they are supposed to hide their menstruation blood. And this has also happened in Satkhira. As we can see in the photo, this small pond, usually these small ponds are very common in Satkhira in every household. These ponds are just like the size of a small house, and often women have access to these ponds because these are behind the house. So when they're supposed to clean those cloth rugs, they clean it in these ponds or in the tubules where they do their other household chores. Clean water is a precious commodity in this particular part of the world, which I've already shown in the beginning of this presentation. Clean water has to be bought from different places, and it is only used for drinking and sometimes for cooking. So women doesn't have access to clean water to clean those rugs. So it is suggested that this is due to the high pH level in those cloth rugs, women are having various sort of uterine infection. But it is important to keep in mind that uterine infection is an umbrella term for a series of infections. We actually don't know what are the different types of infection they're having and for which reasons they're having these surgeries. But what is happening after the surgery, that is more gruesome. When women goes for surgeries to seek remedies, their husband often leaves them because they cannot carry water. After the surgeries, women often suffer in doing heavy labor. Thus, their husband leaves them and marries again. Whether they want children or not, that is not the issue. Women's so-called inability to produce children is used as a way to remarry. So this is sort of an abandonment. However, I will be very cautious using the word abandonment because I haven't done my detailed field work and I don't know what the women feel and how they actually get back to their life, because life continues. So these three stories has two purposes. One, at one side, these three stories tells about my personal journey from the study or from being an activist to the academia. How I personally try to connect the world of activism, the world of academics. But at the same time, these stories are not disconnected from my last 10 years journey into that particular region. As I was almost going back there every year, I see a synergy between these stories. The suffering that women are having today are not isolated, rather all of them are connected. And I think they are connected through these points that you can see on the screen. First, development and systemic environmental degradation that has happened, and that I already have described how development narratives started to emerge in this region. Actually, development narratives in this particular area and the environmental degradation have started to happen much earlier. In the 1960s, when back then East Pakistan was taking flood control programs in collaboration with Netherlands. I'm not going in detail with those histories with this presentation. I wish I had more time to doing it. But eventually, those development projects and development plans divided this whole region into small polders. These polders are like flood controlling zones, and these zones were eventually accumulating brackish water. And suddenly in the 80s, a farmer discovered in this brackish water, there were shrimps coming from the river, probably during the flood. And they started cultivating. And eventually that had become the whole area of shrimp cultivation. And international agencies and also the Bangladesh state found it as a good way for poverty alleviation. Eventually, the narrative of poverty alleviation didn't work out. What it did, systemic environmental degradation, ruining the natural system and also ruining the agricultural system that has persisted in the region. And it also increased the salt and salinity in the soil. So that also connects how development interventions were also part of a natural process. In most of the literatures, it is shown the salt and salinity in this particular region of the country is a direct implication of climate change. But the process of salinification has started much earlier, as we know the climate change narrative today. Thus, the climate change narrative also created water crisis. And eventually that water crisis is creating the problem that women are having. The problem women are having is also connected to the problem of a market-oriented healthcare system, which is not supporting them when they have the suffering. And finally, patriarchal system uses women as a free labor. Because water is a crisis in this region, and women every day has to walk for at least 2 kilometers to get water. That is the lowest. The highest someone can even walk every day 10 kilometers just to get water. And when women are not able to carry the water, they're abandoned. So I see all of these stories are connected in their form of systemic suffering, a systemic form of vulnerability formation. And that is exacerbated people's suffering. Now, after all of these questions, as I mentioned, I'm in the very early stage of designing this research. I encountered the questions, and that is my puzzle. Probably being a PhD student, this is what I'm supposed to do, dealing with questions and finding answers. So the questions I am encountering in many ways. Some are existential. Existential in not like how humans understand environment, the ruination of environment. So the specific question is, how can we critically understand the global climate change narrative in relation to local suffering? And in this particular local suffering situation, that is where the way we understand climate change has to be revisited, has to be understood from different perspectives. Also, I'm dealing with the question, how do we discuss healthcare and healthcare system and environmental degradation and climate change in a single framework? I mean, a lot of words, a lot of jargons. But the problem I'm facing is that these are happening. I'm seeing it happening, but I'm struggling to put them into one framework. Now, is this challenge is a challenge of my own, or also this is a challenge that in academic orientation, we're not thinking? Should we think about our problems from a multidimensional perspective? Probably in future, this is where I'll work. Also, one of the most important aspects that is that how can we look at pain and suffering as a systemic process in a neoliberal system? So these are the questions that I am dealing with, and I will invite you to have your opinion and comments so that it helps me in the further development of my research. Thank you so much. Over to you, Paras and Shubhangni.
Thank you so much, Shakil. That was a brilliant presentation. So much to learn and so much to talk about. I would like to invite now our audience in case they have any questions. I know there was a lot to observe and just absorb. You can put in your questions in the chat directly and we can take them up one by one. If you'd like your questions to be anonymous, then you can send them directly to either Paras or myself. Or you can also just raise your hand and mute yourself and ask away. So any questions?
Shakil, do you want to stop sharing the screen so that we can see people?
Okay, maybe we can, as people are just thinking through and making sense, maybe we can just start off with a couple of questions ourselves. So Shakil, you had a very interesting way of really, I mean, I know you've said that this is a very early part of your research and there's a lot of field work that's to be done, but the very fact that you've picked up stories, really, that's the crux of ethnographic field data, to really go through and try and make sense of the different elements, I found very interesting. And I guess I was wondering if you could speak a bit more just to that method, again, as somebody who has a lot of background in the space. I mean, you've lived a life in that region as an environmental activist and somebody who's really passionate about this theme, even before your PhD journey. So could you maybe speak a little bit about, again, students or scholars who want to take up this method of conducting ethnographic and anthropological research, and let's say the possibilities, of course, because it's a very freeing, empowering method, but at the same time, if there were any limitations or challenges that you also encountered in grappling with this method.
Thank you so much, Shubhangni. Actually, as I mentioned initially, I was living two parallels, like doing two parallel work. Both are simultaneously happening, but I did, first of all, I didn't know how to merge them together, or I was also not sure to bringing together. There is also the dilemma is like, should we bring your passion to your profession? So medical anthropology was my profession. I was doing it and I was trying to learn while my work in public health and also my work at Geneva. So I was not bringing it together. I was just keeping it on the side. And I was, like away from Bangladesh for some time. I was always connected with the people that I have mentored over the time. and we all shared the same vision for Bangladesh. But I actually never was sure that my personal commitment to environment can have connection to actual anthropological research. That took a long time to figuring out. And I think often one thing could be very important is that reflection. I think one of the important aspect here that helped me more often. It was many times I was told that why don't you focus on the environmental activism you're doing? So I was not doing it, I was managing projects. But at one point, actually, my journey took me over to what to do. And it is not me who decided to do the research. I think it is the people, it is the place. That was the call there, that this is something need to be addressed. And so at one way, we can call it a destiny. I'm not sure whether it is objective or not. But at the same time, the absorption of people's life and trying to know it as deep as possible, probably that is when we find something which need to be addressed. Otherwise, if I was asked like 5 years ago about this topic, I would just talk about probably climate change. I would never ever talk about this systemic environmental degradation, and that is how impacting people's life. So yes, it takes some time, but reflection and absorption is very important and key, I think.